Thank you, Fiona, and welcome to the forum. It's so great to have this opportunity to share our work with you. So, hello, I'm Helen Bevan, and Göran, would you like to say hello as well?
Yes, absolutely. Hello, everyone. My name is Göran Henriks.
Yeah, and for the next 30 minutes, we would like to share with you some practical approaches on how to create simple rules for your health and care system. And in this world, as we move to the next stage, hopefully beyond the pandemic, what Göran and I would say is that simple rules are a very effective way of thinking and practical approach to support wide scale and radical change. So, Göran, to start with, I think you're going to talk to us a little bit about the context of simple rules and why why we need to be using this methodology.
Yes, Helen, here we go. I think this question of what kind of system do we want for the future are the most important question, because I believe that future is now. It is what we are doing now that makes tomorrow. So I think that when Don Berwick or Paul Batalden or Edward Deming quoted, "Every system is perfectly designed for the results it gets," we got the right view of how to think about transformation and change. It's not about the people primarily, it is about how we design for the people to work with their work. And if we combine that with an idea that future is now and not tomorrow, we also capture why simple rules are so important. And in my system, the region Jönköping, we have thought all the time that don't wait for tomorrow. Instead, try to design the day we have today and improve that and make the future more fun. Now, what it takes is a good vision that unites people within the system, but also send a message to the citizens what your primary idea is. And in Region Jönköping, the primary idea is for a good life in an attractive region. Helen, here we go. We also think that it's very important to be transparent about how we value our achievements and how we measure our achievements. And for us, it has been very clear that success in our system comes when we can measure our work in lives and in health. We learned a lot when we worked with 13 other systems over the world and developed a conceptual framework named Triple Aim. And the Triple Aim made a platform for us to understand that when you manage a system, you need to view things out of at least 3 perspectives. Today, we understand much better that it's not enough with 3 perspectives. We need 4 perspectives. Therefore, we call it the quadruple aim. We need to value how well we are doing concerning the health of the population and health equity. We need to understand what kind of outcomes do our service and relation to our citizens produce. We have to be aware of how we use our resources. And of course, all this needs people that loves to collaborate, and their well-being are a crucial source for the transformation. You cannot make this happen if you don't have meeting places where people have a chance to connect and develop their employeeship, or better said, their teammates' skills. And we try to help our people to have fun days at work. What you see at the top here is our intensive care unit and how they make a YouTube film about better hand hygiene. We also developed huddle system, so every hospital meets every morning and collaborate around the capacity of the hospital. Of course, co-production with our citizens is a key. So how we take care of the connections, the relationship with our citizens is very crucial. And quite often, that's the most important thing. These three things are only possible if we at the same time understand that it is standardization of the work processes that creates space for reflections and designing the future. And the high jumper symbolize the standardization of a process. You have never seen a high jumper trying to change the way they jump during a competition. Our challenge the last 20 years have been that our structure, our hierarchies, our way of organizing create suboptimation. And over time, we have seen that the houses are both a strength and a constraint of transformation. So today, we do not any longer have CEOs of houses, we have CEOs of care processes. We have made that change because we are aware of a need of redesigning our welfare system from more reactive to more proactive management. And we also have to see that we have to go beyond our today's patient records. For this, we need to picture our work through microsystems, what mesosystems does and what the macro system are doing. And we have understood that it's not only our system that is important for our transformation, it is the whole system that our system lives in. So the collaboration, Helen, can you help me to change the picture?
Yeah, I'll go back.
Go back.
Yeah.
One more, there.
Yay.
The whole, our system needs to work with the whole system of our communities together with our 13 municipalities. And when we can achieve a common goal for our 13 municipalities and our healthcare system, we believe that our citizens can get a seamless approach to health and care. So therefore, today, we map our system not as houses or hierarchies. We map our system as a process where the life are in the focus. So we have to contribute to the health in the daily life to support the self-care and the rehabilitation outside our system and find ways in that. We need to support a new way of doing primary care and a new way of distributing our specialist care. To make all this happen with all the different professions, we need simple rules to unite people in the system thinking. Helen.
Thanks, Göran. And, you know, one of the reasons why I love working with Göran and the colleagues in Jönköping in Sweden is because I see such a picture of the future. And, you know, I think so many of us aspire to the future that I think you present so eloquently there, Göran. But it's like, going back to your question, how do we create tomorrow today? So what I want to do now is just take you through some basic principles of simple rules, and then Göran and I together will show you some practical examples of simple rules. So if we want to get a very large group of people across an organisation or across a whole system to behave differently, if we want to get everybody understanding that and move in a coherent direction, we can do it in two ways. And you might want to talk about this. Göran talked about before and today. But one way that we can do this is by having a very well organised system with clear policies and approval processes and a cascade from the top of the organisation. And if we want to work in that way, and we want to get a lot of people all changing in the same direction, we need to have clear policies and clear operating systems, and we need to hold every formal leader in the system to account. Okay, that's one way of doing it. An alternative way of doing it is by aligning people through a set of simple rules. And basically, we create a small number of simple rules. Typically, we'd have somewhere between 5 and 7 simple rules that have been co-produced, the word that Göran used, and that everyone is accountable for, operating in conditions of much greater individual freedom. I mean, I've contrasted them there as opposites, and I think the reality is, for those of us that work in large systems, actually we need to be working with both. But some of the biggest opportunities, I'd say, as we move into our next stage of being, beyond COVID, transformation, wanting a different future, then actually focusing on simple rules, creating simple rules, I think is a very powerful mechanism for transformation. So I've got a definition there at the bottom of the slide. Okay, simple rules is a core principle for transforming mindsets, the way we think, that drive behaviours and actions in large complex systems. So why do we want simple rules? Well, again, rather than complying to sets of standards and policies, or maybe as well as complying to sets of standards and policies, we want these simple rules so everybody understands why and what we're doing. And there's no point just like creating a set of simple rules and saying, wow, we've got some simple rules here. Actually, when we're creating simple rules, 95% of the effort is the time beyond the simple rules, because, we have to help everybody to understand the simple rules and be able to deliver them in their own way. So what we're not saying here is, these are the rules, this is how you should do it. Neither are we saying, well, do whatever you like. But what we are saying is, these are the ways that we want to work together to create a different future, and express yourself using these elements. So with simple rules, our goal isn't to exercise control over people, but to establish the high-level principles within which we all operate. So let's look at some examples. So the first one here comes from Oldham, and Oldham is a place in the north of England, and the team in Oldham actually created some simple rules for their COVID-19 response. And what we said, somewhere between 5 and 7. So, rather than having, pages and pages of instructions and policies, they just created 5 simple rules. So rule number 1, keep current with the guidelines. And obviously there's the national COVID guidelines, and there's Oldham is part of a health and care system called the Northern Care Alliance. So, we need to keep within the national guidelines and the guidelines of our own system. Okay, we need to work with science, so we need to defer to experts. That's rule number 2. Number 3, coordinate, line things up, don't confuse. Okay. Number 4, keep calm. And number 5, stay kind. Okay, what a great set of rules for everybody to work to. Okay, the next one I want to show you comes from my organisation, which is NHS England and NHS Improvement. And again, what we're looking at here isn't described as a set of simple rules, and very often people don't like the terminology simple rule because because rule means something to people. So what we've got here are some simple rules, but they're actually framed as 7 ways for how we want to work together. And this is about, changing the culture of the organisation. Okay, the way that we work together, the way that we do our daily work, so that it fits with our goal as a system. So. What we've got here is number 1 about speaking up. Number 2, understanding the unique backgrounds and things that people bring. Number 3 is about caring for ourselves and other people and showing in our actions. Okay. Number 4 is about improvement, learning from our experiences to improve what we do and how we do it. So building improvement into learning into everything we do. Number 5 is about collaborating and not just working in silos in an organisation, but seeking to collaborate widely. Number 6 is about delegating and enabling people to feel they've got the power to make decisions. And number 7 is about valuing everybody's time by working in smart ways. So I think this is a great set of simple rules. But what's important about this isn't just the fact that there are 7 simple rules, it's the process that the team at NHS England and NHS Improvement went through to create this. And about 2,000 people actually contributed to the development of these rules, and it was done in all kinds of ways. So there was a system where people were matched up with other people randomly to have cups of coffee and just one-to-one to talk to somebody that you'd never met before in the organisation and say what you found important, and all that was fed in. Okay. There was a crowdsourcing platform where everybody could put their ideas across, and there were special roles for all the various networks in the organisation for people who don't necessarily have a voice. We're at the heart of this process. Okay, so how we do it, how we involve people in creating simple rules, is as or more important than what the rules say. And now we have a situation where senior leaders in the organisation are very actively role modelling this in the way that they work. So, the executive team are talking about how they, role model these ways of working. Individual senior leaders have made films about, what these ways of working mean for them. And this has become very much, part of the organisation. So, here's another set of simple rules. So, Göran, tell us about these.
Well, this comes from the start of the movement of Triple Aim, and it is a summary of some talks that Donald Berwick made the last few years before the century shift. And he said then in these different talks that if we want to design the future of healthcare in a different way, we need to name the problem of the issues in a new way. We have to build on the successes, the examples from all over the world that drives to a better health. We have to take leaps of faith and believe that this will work. We have to look outside our industry into other industries to become successful. We have to set aims and show constancy of purpose in a way that our employers understand that this is not only an idea, this is the way we go. We have to understand system thinking, make action lists, and never ever lose sight of the patient as the central figure. Yeah. I think they are great, these 8 ideas, because they show that that time some of the most important kind of bottlenecks that were both specific and strategic at the time.
What I like about these rules, Göran, is like, when you think about, Don Berwick, who, has got so much wisdom and knowledge about improving health and care. And it's almost like you can get in his head, you know, and what simple rules do is to basically say, we're taking this expert knowledge, or from Don Berwick, and actually we're setting it out in a way that everybody can use it. And I think that's part of the power of simple rules.
Helen, I think I am so privileged to work with you, and you have helped me to reconnect to the world of healthcare, that there is a chance to rebuild it if you just find the right concepts. And together we have tried to distillate what has been our experience over the 30 years of supporting and coaching healthcare, that we have seen as critical concepts, moments, but also strategic issues that you need to come over or work with to transform a system. And we have tried to make 7 rules that we believe strongly can help the leadership for tomorrow's healthcare. The first idea is that it is very crucial to share purpose in a system and in an entity. The second one is understand and remember that people want to belong to something. These 2 rules we will come back to in this presentation. There are 5 more. In modern care, we have now completely new resources to think about prevention and prediction in completely new ways. And how do that affect our work processes and our mindsets? The fourth one is very crucial for the motivation issues. Without structure and trust, you cannot make any steps ahead to a better future. And the combination of agency and structure are a key for all leadership. Just as keeping in mind that complexity is something we live in, and therefore we have to embrace contradictions and tensions and dilemmas that comes up all the time. Of course, giving space for people to reflect and act into new ways of doing things and unleash the opportunities of learning are the leadership's most important things sometimes. We are so productive, we are working so hard that we sometimes forget to reflect, can we do it in a different way? And the 7th rule is about how we can make change in large scale at the same time as the daily work goes on. Helen, do you like to say any comments around this?
Yeah, and again, I just wanted to reflect on our methodology and our approach. And actually, Göran and I have been working on these simple rules since 2013, and they've had so many iterations, and lots of leaders from different countries have helped us, have helped us to develop this. But I think it goes right back, to what you were saying at the beginning, Göran. The future is now. We don't have to wait for tomorrow. We can start creating it today, and based on our own experience and the experience of many leaders and communities that we've had the opportunities to work with through the years. Okay, these are our 7 simple rules around the things that we need to do if we want to create that different tomorrow. These are our rules. So what I was going to do now is just to talk a little bit about the first 2, define our shared purpose and root our transformation efforts in a sense of belonging. And why I'm going to do this is because, again, you know, going back to this theme, how we go about creating our simple rules is as important as what they say. Okay, and the reason why we want to focus on the first two is actually these are at the heart of our methodology for shared purpose. For simple rules. So, you know, if we want to create some simple rules with a group of people, we've got to start with a shared purpose. Okay, if we want to create a set of simple rules that people will stick to in a trusting way, we've got to create a profound sense of belonging. So these first two are not just our first two simple rules for creating tomorrow today. They're actually our first two simple rules in terms of how you create of how you create simple rules. So let's start with number one, which is about defining our shared purpose. So when you think about the world that we are part of, it's increasingly complex, it's increasingly uncertain, and I think, you know, particularly in the context of a pandemic. And you know, when we think about the ways that we traditionally worked, as Göran said, you know, through hierarchy and structured systems, when we're trying to make change happen very quickly, okay, doing things through hierarchy and structured systems is often not an effective way of making change happen. Because, you know, hierarchies are designed for stability and order and to take out risks. And actually, we're trying to make change happen very quickly. So, you know, in our highly complex system where we're interacting with many different people, you know, focusing on shared purpose is a key way to take us forward. You see, if we think about, you know, what happens if we want to mobilize people to take action, the most effective way of doing that is by connecting with their emotions through values. And, you know, when we talk about shared purpose isn't like a technical aim statement, okay? It's a higher level. It's about shared purpose is about connecting with the things that really matter to people. You know, when I went to improvement school a very long time ago, at first I got taught that I'm not a medical doctor, but if I wanted to engage with a medical doctor, I had to show them a graph. Because what I got taught was, if you want medical doctors to engage in change, you've got to show them data. And, you know, data is really important, you know. But actually, if we want people to take action for change, they're far more likely to engage because it connects with the things that really matter to them. You know, what matters to me, and what matters to me is typically connected with emotion through values. And of course, we need data. But you know, if we can actually tell really powerful stories, okay, connected to data that link with emotions and values, that is often the most effective way of enabling change. So actually starting with a shared purpose is a really critical. It's a really critical aspect of that.
We have seen, Helen, that when we use these three words as something that combine the ambition to define the purpose, we get such good conversations in the room. And the first question is about we together. Who are the people? Who will be impacted by the change? Who will need to be part of the change? And who has the power to help make change happen? That focus on the citizens or our customers, and of course on what we should try to achieve together with them. Shared resonates to how do we make this happen as a team. We come from different backgrounds, have diverse views and unique levels of power and privilege, but what unites us? What kind of game plan do we have together? Purpose answers on the question, why are we doing this? And how does it connect to the things that really matters to us? First, asking the questions about our and shared make it very easy to discuss the purpose, because we need to clarify why we are, who we are here for, and how we should play together first. Helen.
Yeah, so I'm just going to show you a practical example of this. And the example that I chose was a very successful campaign across the National Health Service in England, and actually across the world, called End PJ Paralysis, End Pyjama Paralysis. And this was about particularly older people who were in hospital, who weren't being mobilised quickly enough, were staying in bed in pyjamas. And as a result, their health deteriorated. Okay, so end PJ paralysis is, stop people staying in hospital beds when they could be mobilised. And this campaign across England, okay, it was calculated that it saved 710,000 hospital days. So let's look at shared purpose behind that. And let's look at the statement that Göran showed us in terms of our shared purpose. So first of all, as Göran said, who are the our? Okay, a broad group of people. Obviously patients and families, nurses, physios, leaders, doctors, care assistants, students. Okay, a lot of different people. Shared. As Göran said, what unites us? Well, what unites us is our anger and outrage at older patients deteriorating when we've actually got the power to do something about it. We know that somebody who is over 80, who spends a week immobilised in bed, that their muscles can age by 10 years in that 1 week. So what's our purpose? To make sure that every person in a hospital bed gets mobilised when they're ready, both clinically and personally, and that every person gets choice and the chance for the future life they want. Because we know that by mobilising quickly, it might be the difference between, what matters to me, being able to go home and live independently in my own home versus having to go into a care home. So think about this, okay? Think about our shared purpose. Think about it in your general improvement work, and also think about it if you're going to create simple rules. Okay, next topic was about building belonging, and this is a critical task for change agents, people in working in improvement. How are you creating a sense of belonging, okay, in your improvement work, so that everyone is seen and valued for their own unique and authentic selves? And more and more, it's interesting, in the world of diversity and inclusion, more and more people that are passionate about diversity and inclusion in health and care are focusing around belonging. Because, diversity is important, and diversity is the facts. Inclusion is a choice. We choose to include people. But when we talk about belonging, okay, belonging is a feeling, and when we feel we belong, we thrive, and so do the people around us. So how do we build a sense of belonging? So, one of the things I'd say is aim for the top right box here. And what we've got is a 2x2 matrix. And on one axis, it's about, do we value uniqueness or do we value sameness? And the other axis is there's a low sense of belongingness versus a high sense of belongingness. Too often in health and care systems, people end up in the bottom right-hand box. Because yes, we're being inclusive, we're bringing people in, but actually people can't be their true selves, with their own talents. So people feel they have to assimilate, they have to fit in, they have to be guarded. And what we want to do is we want to create a real profound sense of belonging in our change work through our simple rules, so that people feel I belong and I can be myself. And we definitely don't want people to feel excluded. I don't belong and I'm not welcome, and we don't want people to feel differentiated, so that even though their uniqueness is valued, okay, that actually they feel that, I feel I'm different and I'm uncomfortable and it's not a safe place for me to do change. So, okay, driver diagram, how do we build belonging? And so if we want a situation where everybody says I belong, we need to think about the kind of climate that we're creating, where we're welcoming uniqueness, openness, fairness, focusing on what unites us, not what divides us. Okay, leadership is such an important part. Giving perspective, mentorship, inclusion, being kind and civil, and thinking about our practices. Listening to people, giving feedback. Okay. Simple rule number 4, building agency, the power to make a difference, collaboration, and power with, not power over. So, those are, in a sense, our first 2 simple rules. So coming to the end of our talk now, Göran, what would your reflection be around our 7 simple rules for leaders creating tomorrow?
Well, may we change to the next picture first, Helen, and repeat why we believe it's so good to work with simple rules. We think that in the time we are, where we have to go back not to the old situation, to a much better situation, we have a chance if we develop as leaders simple rules and start with our shared purpose. Understand that be divergent and convergent are very crucial in the leadership. Keeping the ideas of improvements as a center of the language, but also as the center of moving ahead, and the PDSA cycle as a crucial tool. Co-create with people both inside and outside the system and be a part of them as a leader, and find multiple ways to engage. Find new meeting places, and the digital devices we today have makes it even more fun. And then remember that 95% of the work is after you have created your simple rules. So this is the way to unite people, how they can reconnect and rebuild the system that they live and work for.
Thanks, Göran. So just to say that Göran and I are doing a blog series for BMJ Leader, and we're in the middle of it at the moment, and we're just about to publish our next blog, which is about simple rule number 3, predict and prevent. So if you want to see some of our thinking and our perspective, do read these. So we finally, just want to we're just thinking about a quote to end with that would kind of capture the kind of spirit of this. And we chose this quote from one of my favourite plays, which is called Pride by Stephen Beresford. And what next? Okay, whether we march with banners or without. Okay, the important thing is that we march together. All of us. That's what this thing has been about from the beginning. And that absolutely is how it's going to end. Together, us, united. And for me, this is about the spirit of simple rules. It's about having a shared purpose. It's about uniting everybody in our organisation and system around things that really matter to us. It's about specifying what the simple rules are and enabling everybody to go forward together. And I think this is also a really pertinent, relevant quote in this era of pandemic. Because, when we think about the future that we want to create, creating tomorrow, today, no one team, no one system, maybe not even one country is gonna sort this. Okay, we have to do this together, us united. Göran, final words.
No, Helen, it's fantastic to work with you. Lovely to have a chance to do this message together with you. Thank you all. Let's learn during these 3 days.